Thank you very much for coming to my presentation. I know it's just Thanksgiving weekend was just there, and so thank you very much for coming. So today I'm going to talk about my one of the research study that I did earlier this year. It's entitled Student Veterans Resilience, a Constructivist Grounded Theory Study. So before I begin, I just want to kind of explain what my research program is. It's really about resilience research in post-traumatic stress. It's about resilience in people with post-traumatic stress disorder, and also about acceptance and mindfulness in PTSD. So I have a banner here that I always bring with me whenever I have a data collection. Just like here, I went to the Philippine Nurses Association. They gave me a table. They generously gave me a table, and so I was collecting a data of Filipino American women's resilience as well. So that was a different research study. So, and I have here, on this picture here, you probably know her, Michelle Giddings. She was a faculty here before. She's now the president of the American Psychiatric Nurses Association. And that is Carl Der Cotrara. He is one of a fellow in the Asian Community Development Council. So he was there for a reason as well. And the theme of that day was about mental health, so that's why Michelle Giddings was there. She was a speaker during that day. So, when I was making this banner, I also put a tagline here that says, "Thriving in Trauma, Thriving with Trauma." Some of my friends, when made some suggestions, they say, why don't you put it "Thriving in Trauma, Thriving through Trauma," or "Breaking through Trauma." So I said, that's very good suggestions, but they are not really in alignment with the philosophy of the interventions that I'm going to eventually test. So this is really this really demonstrates my research trajectory. I'm starting first on exploring resilience among people with PTSD, more particularly student veterans with PTSD and Asian American women with PTSD or history of trauma. Then later on, I am also, as those are descriptive exploratory study, I'm going to be testing developing interventions. And the interventions are basically on acceptance and mindfulness in PTSD, basically on the foundation of the principles of acceptance and commitment therapy. And so this tagline here is about, how do you thrive despite trauma? How do you thrive in trauma and with trauma? That's what it's really all about. So, and so some of my grant proposals that I submitted are interventions-based, or intervention studies, and they are basically testing resilience interventions based on acceptance and commitment therapy. So, in alignment to my research trajectory, I have started first looking at integrative review of different PTSD interventions with resilience as an outcome. So, Dr. Lee Henna, with some couple of undergraduate students, and my mentor at the Department of Psychology, Dr. Kearney. He's a distinguished professor as well as the chair of the Department of Psychology. His expertise is on PTSD. So we published an integrated review of post-traumatic stress interventions with resilience as an outcome. So it's to have a start, a foundation of different PTSD interventions. And so I received an acceptance letter, and hopefully it will be published in print this year, 2017. Okay, so the objectives I have for today is to discuss how military veterans who return to school construct and enact resilience within their personal and academic lives, and to explore the implications for research and practice of student veterans' understanding of resilience. So this study was actually now, it's published online at the Journal of Psychiatric Mental Health Nursing. I received a letter of acceptance. It's already accepted in October and published online in October. And hopefully it will be published in print in the year 2017 as well. I'm so very curious. I'm so very particular all the year of publications because I'm a tenure track faculty. So, and I want to just acknowledge the funding for this study. Thank you, Dr. Yuha, for the funding. It's from the UNLV School of Nursing Dean Research Support Fund. It's actually the fancy name for my startup funds. Okay, so thank you. So I'm just going to give a little bit of a background of this study. So nurses know firsthand that military veterans transitioning to civilian life face a multitude of difficulties and stressors. So military veterans returning to college not only have difficulty reintegrating back into their civilian communities, but they also struggle to transition to college. In fact, many military veterans consider transitioning to college as the most difficult adjustment for them. The stressors of student veterans are complex because many of them return to college with psychological disabilities and psychiatric disorders that they acquired or developed from military service. And these disorders can adversely affect how they cope with their academic and personal challenges. So, a U.S. national study of student veterans reported that 46% of student veterans have severe PTSD symptoms. 46 of them have contemplated of suicide. About 35% have severe anxiety, and 24% have severe depression. In another study, Widom and Berry found that student veterans have higher rates of problem drinking behaviors and high-risk behaviors related to alcohol, like high-risk driving, use compared to non-veteran students. And additionally, Elliott concluded through their study involving student veterans that the severity of PTSD symptoms predicted more problems related to alcohol. So psychological and psychiatric issues also affect academic performance. PTSD symptoms of student veterans significantly correlate with low levels of academic adjustment and lower self-efficacy for learning. Student veterans with more severe symptoms of depression also reported significant difficulties in adjusting to university life. They also have significantly poorer academic performance and lower graduation rates than non-veteran students. Additionally, psychiatric symptoms affect their personal and non-academic aspects of their life, including significantly less emotional support from peers compared to non-veteran students. They have more physical fights compared to non-veteran students. They have greater hostility in intimate relationships compared to non-veteran students. And this problem about PTSD symptoms and other mental health concerns of college student veterans is really a public health concern, especially because a lot of these students have availed the tuition assistance for student veterans from the post-911 GI Bill. Okay. This was a congressional bill issued around in the 90s. So what happened then is that it resulted in an unprecedented increase in enrollment of college student veterans. Academic institutions have to deal with the influx of student veterans with psychological disabilities, and many schools do not have adequate infrastructure to support these students. But there is a phenomenon called resilience that helps people to thrive in the face of adversity. Resilience is also a measure of stress coping ability. It also buffers the negative impact of stress. So there are studies about resilience of student veterans that have been conducted. But most existing empirical literature on student veterans' resilience focus on the related factors of resilience and what are the benefits of resilience. For example, quantitative studies highlight that the resilience of student veterans is a significant moderator between combat exposure and PTSD symptoms. This means that when resilience was low, PTSD symptom severity was high, as combat exposure levels were also high. Ekman compared indicators of resilience between student veterans and non-veteran students, and they found that student veterans had lower levels of resilience than non-veteran students. Young found that resilience was negatively correlated with depression and the perceived stress of adjusting to college. So there are also qualitative studies about resilience of student veterans, but mostly they all talk about the characteristics of resilience in their lived experience. For example, Henderson White found that resilience was a driving factor for students to complete their education. Iverson found that resilience of female U.S. military veterans that they developed from military service contributed to persistence in their college education. And Normandin, from an ethnographic study, revealed that student veterans' resilience was critical in redefining their identity as civilians and as students. So what's the gap in the literature then in terms of resilience? Because we have studies about resilience of student veterans. So empirical studies about resilience of student veterans exist, but that there is limited theoretical explication of resilience in relation to the academic civilian life. Developing a theoretical description of student veterans' resilience will provide us insights into the processes and contexts that facilitate resilience. So that's why this is my foundational study, because this will inform me in creating interventions for college student veterans. So despite the knowledge, we already have some studies about the factors that impact resilience. What are the factors related to resilience of student veterans? But there is no coherent model or theoretical framework that can be found that explains resilience as a process. So we need that. We need to explore more on resilience as a process in order to have a philosophical foundation, a very good foundation in creating interventions that is really helpful for them. So the purpose of this study is to explore how student veterans construct and enact resilience within their personal and academic lives. So that purpose and that research question really lends itself to a grounded theory method. And the method that I used here was more specifically a constructivist grounded theory. A constructivist grounded theory was used to guide data collection and analysis, as there remains limited theoretical explication of student veterans as a resilience. So grounded theory was appropriate here because, according to Hutchinson and Wilson, they say that when there is lack of available theories to explain human behavior, a grounded theory approach is more appropriate. So what is a grounded theory methodology? It is an inductive methodology. So this is just research 101. So inductive, what it means to say, you have specific observations, and then you go up to generalizations and a theory. Compared to a deductive, we test a theory, right, by formulating hypotheses, and now we test those hypotheses. So that's deductive. So grounded theory methodology is also generally considered a qualitative research methodology, and it has a set of rigorous research procedures leading to the emergence of conceptual categories. So the outcome is conceptual. It's a generation of theories from data. So it's a little different from a traditional qualitative methodology like content analysis, thematic analysis, where the result, the outcome of the study is more descriptive. This one is more conceptual. Okay, and we need to, the grounded theory. The reason why it has to be conceptual because so that transferability is more broader. So with transferability is a more, in other words, in a quantitative research, we call it generalizability. So we don't really say generalizable findings in qualitative studies. We say more, are the findings more transferable? So the research paradigm in a grounded theory methodology is interpretivism. So again, let's just go back to Research 101. There are 3 or 4 main research paradigms. We have positivist / post-positivist, the interpretivist paradigm, the critical theory approach paradigm, and the post-structuralist paradigm, right? So the quantitative research is not a paradigm. It's just a particular method, right? So there are some qualitative methodologies that are in the post-positivist. Most quantitative research are post-positivist. But there are also qualitative methodologies that are post-positivist in paradigm, like content analysis and thematic analysis. So the most common interpretivist qualitative research methodology are grounded theory, the phenomenology, and ethnography. Those 3 ones are the most common interpretivist paradigm in the qualitative research methodology. So there are 3 main types of grounded theory. We have the classic grounded theory by Barney Glaser. He is the actual originator of the grounded theory. I'm a student of Barney Glaser. I directly studied with him, but I did not tell him that I used Sharma's constructivist grounded theory in my dissertation as well in this research study. And the other one type of grounded theory is Straussian grounded theory. We have a PhD student together with Dr. Colosimo and Dr. Dingley, who is using Straussian grounded theory. So a constructivist grounded theory was developed by Kathy Sharmas. Kathy Sharmas was also a student of Glaser, but she developed her own particular type of grounded theory. It's based on constructivism. The ontology is relativism. meaning to say that there is no objective reality, that there are multiple realities and multiple perspectives on these realities. And it is the epistemological assumption of constructivism is subjectivism, meaning to say that knowledge is subjective and that there is no external or objective truth, and that the researcher is inseparable from the participant. So that's why in a grounded theory, it's very important to write a lot of reflections and memos, reflecting about your own values so that they don't affect the values, the perspectives of your participants. Okay. And it begins with a specific question in a particular substantive area. Compared to a classic grounded theory, it is about the main concern in a substantive area. So that's why my research question is, what is the student veteran's understanding and enactment of resilience? If it's a classic grounded theory, the research question would go like this. What are the main concerns of student veterans? It's a little more broader, but there's so many main concerns of student veterans that have been researched already, so I'm not going to that route. I'm more particular for a particular process of student veterans, which is the resilience. So that's why constructivist grounded theory methodology was more appropriate. But the main elements of a grounded theory, the main tenets of a grounded theory, which are the constant comparative methods, the theoretical sampling, and the writing and sorting of theoretical memos, are maintained in the constructivist grounded theory. So what are the inclusion criteria of my study? They have to be 18 years of age or older, that they have served in combat in any of the U.S. military branch. When we say military branch, they are the Navy, Marines, Air Force,
Coast Guard,
Army, and did I say Navy already? Okay. And they are currently an undergraduate student of UNLV. So we just focus on undergraduates, not the graduates as well. So how we recruited participants, I asked the director of the UNLV Military and Veterans Service Center to email all the student veterans registered in this center. We used a purposive sampling. There were 20 students that were participating in this study, 16 males and 4 females. The age range is 26 to 50, and the mean is 34.05 years. These are the military branch. Most of them were Air Force. Most of them were studying only, but there were a lot of people also working part-time of less than 40 hours. But there were also a lot of people working full-time, studying full-time. Most of them were married and in a committed relationship, and most of them were honorably discharged as a veteran. Okay. Some are still individual ready reserve, and one was medically discharged just because he had severe traumatic brain injury and PTSD. Most of them accessed any kind of healthcare services like medication, psychotherapy, primary care, mostly from the Veterans Affairs. They did not access healthcare services within UNLV. And most of them also received disability benefits. So how did I do the data collection? So once they have an appointment with me, I collected a demographic data questionnaire. I also asked them to complete a resilience scale and also a PTSD some severity scale. And then we did the interview, face-to-face recorded interviews lasting 1.5 hours to 2 hours using a semi-structured interview guides, and I also completed a field note. So which means after every interview, I have to go and jot down what I observed, how did the student answer the question, some of just my observations. So it was a lot of work doing this qualitative study. So key questions of this study, there were other probe questions, but these were the 2 key questions. Would you please share some of your experience of stress and difficulties as a university student since you returned from the military service? How were you able to manage the issues around your stress and difficulties as a student since your return from the military service? So I analyzed the data using an in vivo 11 software. I used 3 coding phases as recommended by Sharma's initial focus theoretical. I also used a constant comparative method, which is a key analytic process within grounded theory. It is a method involving comparing coded data from one participant to another, as well as comparing incidents within a participant's data with that of other participants. Then I also wrote memos, and I also sorted those memos. When we say memos, those are regularly written during the data analysis. These are high-level ideas of codes and categories. So in a regular conventional, traditional qualitative analysis, you analyze them by codes and categories. But in a grounded theory, you have to write a memo, which is more theoretical. Theoretical notes. So you write theoretically, conceptually, those codes and categories. Okay. Glaser, who is the founder of grounded theory, said that if one doesn't memo, then he or she is not using or doing grounded theory. So memoing is a critical part of grounded theory. And I also did theoretical sampling. So that's why there's an iterative data collection analysis. What it means is that when a typical traditional qualitative analysis methodology, you will just interview everyone, 30 interviews, and then you analyze them, right? That's very overwhelming for a grounded theory, and we don't really do that in a grounded theory. What we do in grounded theory is that we interview one participant, and then after that, we analyze the data. We code it, and then we ask more questions. What else are we missing here? What other questions can we ask for the next interview? So that's theoretical sampling, because you really want to refine your theory by asking more. You might have to, change your probing questions in order to refine your theory. So that's what, again, theoretical sampling is a key thing in grounded theory. And then theoretical saturation was achieved after 20 interviews. When we say theoretical saturation, is that as I collect the data, there are no more new properties of the conceptual category. So later on, there is a category of the dissonant self. So I'm looking at different theoretical descriptions of that category. So if there are no more new emerging description of that particular category, then your theoretical saturation is achieved. Then part of the constructivist grounded theory is doing member checking. We go back to the participants, we show them the transcript. These are the codes and the categories. Does this resonate with your experience? But we were only able to go back to 16 participants. 4, we were not able to trace the other 4. So ethical consideration, this was approved by the UNLV IRB. As usual, we obtain an informed consent, and all the digital recordings, files of digital recordings, transcripts, and completed interview questionnaires were assigned an alphanumeric codes without their names to preserve anonymity. So just like a quantitative research where you have to select a reliable, a valid instrument, in qualitative research we also ensure that our research procedures are rigorous. So I use LinkedIn and Google credibility and confirmability. So credibility was used to establish rigor and trustworthiness of the qualitative data. It means to say, are the findings believable in a way that, and we did that by having the participants themselves validate whether the interpretation of the data reflects their experience and context in a believable way. And we did that by member checking. Confirmability is about how well the data supports the findings. So what we did, as the main researcher, I analyzed all the transcripts, and I have another researcher who analyzed a sample of transcripts independently of me, and then we compared notes to see and to minimize coding errors. There is an audit trail that we also have to produce, which means to say it is a systematic and detailed documented evidence of my methods and decisions of analyzing and interpreting data, so that if there is an external auditor who would like to look at it, they would be able to trail all my qualitative analysis decisions. So this is how we ensure rigor of the qualitative methodology. And of course, every type of grounded theory, they also have their criteria of evaluating grounded theory. I use Sharma's criteria of evaluating grounded theory, which is credibility, originality, resonance, and usefulness, which is just a repetition of credibility and confirmability. So the results, the level of resilience of the participants was about 31.8, which is more on the higher side. And we compare this with other studies. This is usually higher than non-veteran counterparts, which are college students, but similar level to non-student military veterans. So we couldn't find a study on resilience of student veterans. We also did PTSD using the PCL-5. The mean score was 23.05. So a usual score would range, the score ranges from 0 to 80. If your score is 80, you have severe symptoms of PTSD. The cutoff score for PTSD screening is 38. So if you're above 38, That's you have clinical symptoms of PTSD below 38. You may have symptoms of PTSD, but it's not clinical symptoms. So most of them have reported limited severity of PTSD. Share to you the results of the qualitative analysis. So the process of integrating was the core category that emerged as the of the grounded theory. It represents student veterans' construction and enactment of resilience. There are three main subcategories of the process of integrating: aspects of integrating, expressions of integrating, and enactments of integrating. So this is the picture here. So we have aspects of integrating, which are the transition from military to civilian life and harmonization of personal and academic life. Expressions of integrating, the dissonant self and the integrated self, and the enactment of integrating, recognizing, resonating, reactivating. Okay, so let's start with the aspects of integrating. Student military veteran service and the complexities of their new civilian life make them a unique group of students. Transitioning to civilian life while harmonizing their personal and academic lives forms the basis for how they perceive their challenges and how they implement solutions to address them. In other words, within the context of the student veterans' academic and personal lives, they must learn how to make a transition from military to civilian life and how to harmonize the various areas of their personal and academic lives. So from transition from military to civilian life, within this aspect of the process of integrating, a student veteran's previous military experience can be both an obstacle and a strength. As an example, many participants had difficulty adjusting to the lack of structure and increased freedom in their civilian life. On the other hand, they also use skills learned from their structured military environments in their studies. This was evident in how they displayed punctuality, how they submit requirements earlier than the deadline, how they communicated in a respectful way to their teachers. So compared to other students, student veterans are distinct in their exposure to traumatic events while they serve in the military. Although the mean PTSD score of participants was below the cutoff score for screening PTSD, there were many who reported psychological symptoms that interfered with their both personal and academic lives. Some of the symptoms commonly reported were hypervigilance, guardedness, suicidal ideation, anxiety attacks, sleeping problems, distractibility, feelings of guilt, being easily startled, and difficulty concentrating. These symptoms of psychological distress, particularly suicidal ideation, were common struggles of participants because many of these students transitioned directly from military to college life, leaving them very little time to adjust to civilian life. Additionally, the symptoms severely affected both their experience with their academic courses as well as non-academic personal areas of their life. The following comment illustrates how one student veteran was optimistic that he would not struggle with mental health issues, but only to find that he would. Here's an example here. To take the easy way out, it's not me. But I couldn't believe that I reached to the point where I was actually thinking, referring to committing suicide. I always keep a loaded 45 next to my bed just because if somebody breaks in the house, but I'm sitting here and I'm looking at the gun and I'm like, one shot to the chest can't hurt as bad as I feel right now. That's participant number 9. So the second aspect is harmonization of personal and academic life. Within this aspect of integrating, student veterans are challenged to harmonize different areas of their personal and academic life. This requires organizing various commitments and responsibilities that are both personal and academic in nature. Participants in the study reported that they were generally older than their classmates. Most had family commitments, part-time or full-time employment, caregiving responsibilities to sick family members, and or their own physical and psychological health issues. At times, these different aspects of their lives interfered, while at these other times they organized themselves to support their studies. Here are contrasting examples. I have a lot going on right now, a lot of external stresses, and that's why I failed this course. All of my classes are related, and this one is a more positive example. All of my classes are related to my major because it's all related to my job. It all ties in together. It very much helps that it's interesting and applicable. So I'm now going to the expressions of integrating. The process of, which are the dissonant self and the integrated self. The process of integrating manifests itself in two main expressions, the dissonant self and the integrated self. Although these two appear contradictory, they are not mutually exclusive or diametrically opposed, meaning that participants went back and forth between these two expressions. The desired outcome is an integrated self. However, participants facing adversities at times retreated into dissonant self. In fact, the dissonant self can indicate that the person is also resilient. The dissonant self is simply a starting point from which the student veteran strives towards the integrated self, which is a way of being where there is a harmony between the veteran's personal and academic domains of life, as well as smoothness in their transition from military to civilian life. So in the dissonant self, student veterans experience resistance to the new conditions of their civilian life. They encounter conflicting perspectives, particularly the incongruity between the assumptions and practices they develop from military service and the ways of life they now observe in the civilian life. They experience a lack of validation of their depth of experience. So some of them have encountered life and death situations, and they feel dissonant with young classmates who don't have any idea what life and death situations are. They attempt to avoid situations that incite traumatic behavioral responses, and they doubt themselves due to unfulfilled expectations. These conflicting perspectives result in dissociative behaviors, anger, suicidal ideation, anxiety, feelings of guilt, social isolation, impulsivity, and distraction from doing meaningful activities. The following is an example of a dissonant self in which the student veteran struggled with conflicting expressions of emotions. When I came back from military service, a lot of emotions happened. You don't really want it to come out, but you try to hide it by being comical, being positive, but really deep inside it's hurtful. It's there. I'm going to school because it keeps my mind away from things. But when there's a lot of things happening in school and at home that I remember a lot of those things, referring to incidents during the military service, as well as other things that involved when I got back on friendly grounds, referring to incidents upon return to home country, it makes you want to either hurt someone or hurt yourself. So the integrated self, within the integrated self exists a balance between accepting one's problems and or challenging situations as an integral part of the human experience and taking actions toward resolving difficult situations. In other words, in the integrated self, the person acknowledges the inevitability of difficult experiences in one's life and at the same time take actions to address or resolve problems and challenging situations. In this example, the student veteran progresses towards the integrated self by acknowledging his struggles. During the breakup with my girlfriend, I considered going back to military, but I got out of the military to go to school, and that was my plan. I would say there was part of me that was considering just signing back up, just re-enlisting and leaving Vegas, and just to go back in the military. But I kept reminding myself I'm going to get more with a degree versus just playing off the military. I decided I needed to stick it out with school, and I continued transferring, referring to shifting majors, even though I broke up and she still lives in the city. So, and lastly, we go to the enactments of the integrating. Although the student veterans may be handling multiple commitments and responsibilities in the integrated self, there is a sense of harmony between personal and academic life. In the integrated self, the student veterans is transitioning smoothly from military to civilian life. There may be bumps and difficulties in the transition process, but the student veterans applies different enactments of the process of integrating aimed towards the integrated self. So there are three components of the processes of the enactment of integrating: recognizing, resonating, and reactivating. Although they are not necessarily sequential, student veterans typically begin with recognizing when resolving their dissonant self. They go back and forth through these processes and change between their dissonant self and their integrated self, depending on how they use these processes within their personal and academic lives while transitioning from military to civilian life. So recognizing this enactment involves noticing and acknowledging the source of dissonance in the dissonant self. The desired outcome of recognizing is to gain clarity about the nature, characteristics, and magnitude of the challenges and issues within the dissonant self. A common awareness among participants was the universality and diversity of the challenges they confronted. They acknowledged that their difficult experiences were not unique, but common ones, while at the same time remaining aware of the various possible responses to them. Here's an example of recognizing. Oh, I just realized that this, referring to being in college, isn't the environment for that kind of stuff, referring to using military ways of communicating. A lot of these military veterans have developed very direct, authoritative way of communicating, and so, they kind of have a difficulty using this type of communications with their classmates. I see that the other students are just in a different place in their lives where they don't need that kind of stuff. Why do I need to bring that type of personality onto them? So this person has more self-awareness of how it's not appropriate to use this kind of communication in a civilian context. Other issues that participants were commonly aware of in their dissonant self were the self-limiting nature of their challenges, the inevitability of pain and suffering, their personal triggers or their dissociative behaviors, and the need for an external intervention like a professional help to address the persistence of their problems. Recognizing is vital because a person becomes aware of one's dissonant self, and then it creates an opening needed to get help, ask for support, and for the other two enactments to occur. So here's an example. You realize that you're not the only one having those feelings, referring to having inner conflicting military and civilian belief systems, or going through that. So people were there to be supportive. I started opening up to my leadership. They're like, I know exactly what you mean. I went through something similar. They made it very clear that we all go through things, and it's okay. If you need help, you need help. There's nothing wrong with that. And then the second enactment is resonating. This enactment relates to arousing or amplifying the veterans' purposes, promises, and commitments, particularly those related to achieving their academic goals, addressing their challenges, and resolving their problems. Resonating results in generating or revitalizing hope and confidence. Remembering their purpose, promises, and commitments inevitably build confidence and hope. Resonating clarified their doubts and in the face of challenges and adversities, such as doubting their ability to achieve academic goals. Student veterans' confidence and hope mostly related to the self-affirmation of their ability to address the uncertainties and obstacles in their future. Here's an example of resonating. I wanted to go back to school, and I was constantly told, you can't go back to school. You have a very little memory. You have a brain injury developed from an artillery incident in Iraq that's getting worse. I just don't let those things get me down. I'll keep doing what I want to do until I can't figure out a way to do it anymore, until I absolutely can. I've always been that way where I can push myself to do what I want. I'm just confident in myself that if I want to do something, I'll do it. Resonating also created a sense of urgency to persevere, withstanding their challenges, and finish what they started. I realized, oh man, I'm getting left behind in the world. You're falling behind. Before you know it, you're 27, 28 years old, still in school. It was a very common experience for them. A lot of them were older than their classmates, so they really wanted to finish school. And reactivating. Reactivating in this, the student veteran reapplies values, skills, and abilities, as well as general beliefs, assumptions, and practices learned and developed from their military service and or past experiences. It is more of an external process than an internal one. For example, taking actions rather than just thinking about taking action. Changes within the veteran's reality are more tangible and visible. Because of this, they are more willing to pursue available opportunities, facilitating an upward spiral of well-being and positive emotions. Student veterans demonstrate reactivating by intentionally applying structures from their military life into their civilian life. This may include demonstrating excellence and thoroughness, facing obstacles rather than opting for the easy way out, being grounded in the present moment, acknowledging the chain of command or authority, maintaining camaraderie, and focusing on the task at hand. So these are some things they learn from their military that they apply into their civilian life. The following are examples of upholding the value of excellence learned from the military service and applying to civilian life. The standard is there to get you in, but the max is what you're shooting for, because if you shoot for the max, if you shoot for the A, you don't get it, and you don't get it, you get a C, you still pass. I can't just say here and do mediocre. The whole time in my military career, I was like that. Never strive to be mediocre. Participants coping with post-traumatic stress symptoms also demonstrated reactivating by actively applying skills learned from the therapy. For example, this participant applied reactivating by using grounding techniques learned from therapy to cope with his post-traumatic stress symptoms. Sometimes when I'm driving and I look out into the desert, referring to the desert areas in the participant's home country, the U.S., I phrase it like that because this was an international journalist based in Great Britain, so I cannot just say referring to Las Vegas. So I get really back into that zone, referring to re-experiencing symptoms of PTSD. I did a lot of convoys in Iraq and Kuwait and other places. The terrain is very similar. I'll snap back into that. I'll have to ground myself and explain to myself, come down. So this participant, being in Las Vegas, where it looks like Iraq and Afghanistan or Kuwait, he has to learn how to calm himself down by grounding himself. The grounded theory of the process, reapplying the practice of focusing on the task at hand was another common example of reactivating. So military veterans, they were, focusing on the task at hand. What are the things that you need to do? So they apply that into their civilian life. As exemplified in the following comments, student veterans focusing on making the changes they needed to make, such as seeking professional help, rather than not taking actions like isolating or avoiding treatment. Before I even went to Afghanistan, I told my family, if I come back any different, you tell me. I went overseas and I came back. They say that I wasn't as happy anymore, that I wasn't laughing. I didn't want to just be here doing nothing. I did go see a psychologist for that. So what do these findings mean? We have now the process of integrating, the grounded theory of the process of integrating. What do these findings imply? So the grounded theory of the process of integrating reveals how student veterans construct and enact resilience. The structure of this grounded theory, which is comprised of three subcategories, the aspects, the expressions, and the enactments, offers new evidence about the resilience of student military veterans. More particularly, these three subcategories of the grounded theory of integrating suggest that the experience of resilience among student veterans is a dynamic process, a process that has not been described in previous research on student veterans' resilience. For example, the first subcategory of integrating the aspect shows that resilience is a complex process that involves multiple contexts of student veterans' life. These include the transition from military to civilian life, as well as the many dimensions of the personal and academic life. The findings of the study show that resilience pertains to not only coping positively with stressors and challenges, but also struggling with the transition from military to civilian life. The expressions of integrating, what it means is that it demonstrates the iterative nature of the student veteran's resilience. So meaning to say, resilience is not simply a straightforward, linear, unhindered process. So we found that there is a transient nature called the dissonant self. So meaning to say, student veterans, when they're feeling dissonant, it doesn't necessarily mean that they are not resilient. It's just part of the process of resilience. And lastly, the enactments of integrating shows that the central focus of integrating is about actions involved in the process of resilience. So resilience is not simply a trait or a characteristic, but it is a process that involves action. So meaning to say, it has actions. It is an action-oriented process. So some of the limitations of the study, participants came from one university only. So meaning to say, transferability of the findings, meaning the generalizability of the findings, could be limited to, student veterans who have the same characteristics of the chosen university. In addition, the study is conceptual in design. It would have been interesting to interview these participants a year after and what is resilience like for them. And majority of the participants scored below the cutoff score on the PTSD checklist. It would have been interesting to have if a lot of the students who showed up for participation have severe symptoms of PTSD. Okay. And then the PTSD symptom severity and level of resilience were not quantitatively analyzed because this was a grounded theory study. We just we asked them to complete those questionnaires so that we have a general sense, so we could be able to contextualize the qualitative data. But it was not used. We did not integrate this quantitative data into our qualitative analysis. So what are the implications for nursing practice? For the aspects of integrating, it means it offers a holistic perspective when supporting student veterans' resilience. So meaning to say, psychiatric mental health nurses and other nurses supporting student veterans, they should not only be focused on academic context, but also on the other personal, non-academic context of their life. Expressions of integrating, it provides a framework for enhancing student veterans' resilience, meaning to say that the grounded theory of integrating can be used as a tool to help student veterans locate themselves where they are in the process and use that the process of integrating as a tool to move from the dissonant self to the integrated self. And the enactments of integrating, it reinforces the fact that resilience is an action-oriented process. So meaning to say, as a mental health nurse or a nurse helping student veterans with PTSD, for example, you can focus on actions like resolving, reactivating, and resonating, as opposed to just focusing on the events that happen, why the events happen, why are the symptoms happening. So more on action-focused solutions. So that's really it for me. We have 10 minutes for questions.